Hello. Today, we're going to be talking about children's vaccinations from age 5 to 11. Yesterday's press conference, Governor McKee and the Rhode Island Department of Health has already explained their plans for vaccinating children. But do they mean that they're ready to do it right now? No, that's not. They're just telling you ahead of time their plan, and I will explain that to you. Right now, Pfizer has already submitted their paperwork to FDA, and the FDA will meet on October 26th, very soon, to review their application and their trial run reports from vaccinating children to make sure that they have met all of the FDA requirements. Once the FDA has approved it, it will go to the CDC. They have a committee. They will review it the same as the FDA and make sure that it's safe and approve it. And then it will go to the Rhode Island Department of Health, and we will move forward vaccination. Rhode Island Department of Health feels that around the middle of November, they will be able to start distributing the vaccine to children aged 5 to 11. But that will only be Pfizer. Moderna and Johnson & Johnson have not been approved. They have discussed sending their information to the FDA, but so far Pfizer is the only one who has done so for children's vaccination. So the Department of Health will reach out to all of the pediatricians in Rhode Island and family doctors and ask them if they are willing to take part in this vaccination. And out of 134 doctors, 81 have already said yes, that they would participate, and we expect most of the rest will sign up. The Rhode Island Department of Health feels it would be best for your child to get the vaccination at the doctor's office because the parents have an already built trust with their doctor rather than going to a state-run facility or to a pharmacy. The children and the family may feel better going to your family doctor, but you do have choices. You can go to CVS or Walgreens, or you can again go to a state-run site, the same that have been happening throughout the process of COVID, where you go online and make an appointment, and then you would bring your child to the vaccination appointment. Also, schools in Rhode Island, K through 8, will also be providing vaccinations, so you will have options for your child. The Department of Health has warned parents, however, that we have about 80,000 children in Rhode Island between 5 and 11. And we will not get immediately 80,000 doses from the government to be able to distribute to the children in Rhode Island. If you remember from when adult COVID vaccinations started in 2020, for the first few months, we only got a very limited supply because they were still making the vaccine. And as they were able to make more, we were able to get more. So Pfizer has not started producing the vaccine for children yet. They are waiting for the FDA and the CDC to accept it, and then they will proceed with making the vaccine. But we will just get small amounts of doses, balancing us out with all the other states in the country to make it fair in the beginning. So probably the first month or 2 months, it may be a little difficult to get the vaccine, but I would say by 3 months, February or so, we should have enough vaccine for all the children in the state age 5 to 11. It's really important. Children who have not had vaccines yet still need to wear masks because it can still impact children. They can get it from adults. So we need to protect our children so they're not getting positive tests for COVID. I also understand that Pfizer said when they make that dose for the children, it is not the same dose as the adults received. The percentages of vaccine inside are reduced. So it's more of a light dose because of their age and their weight. And so the adult dose is reduced to give to children. So that's why, they haven't even started making it yet until everything is approved, and then they will proceed around mid-November. And I'm informed as things change. Thank you.